the last 20 years, radiation has changed a lot. I mean, I talk to a lot of patients who have family members or friends who got treated, 30 or 40 years ago, and there are some horror stories about what those people went through. But I think the modern radiation, our imaging has gotten much better. We're able to make sure that we see tumors much better. That allows us to shrink the areas that we treat. We also are much better at setup and monitoring during the treatment, again, allowing us to give a really high dose of radiation to the areas that need to be treated, but sparing all the areas around it. When I say sparing the areas around it, I mean able to give a really high dose of radiation to the tumor, but at the same time, taking the high dose of radiation and keeping it away from the tissues around it, the organs around it, a lot of things that can cause side effects if they get too much radiation. We're really giving really high doses of radiation. We're sculpting the doses and taking doses away from critical things that are nearby, and that allows us to sometimes even go to higher radiation doses, get better cure rates with lower side effect rates. The technology that we have here at the Green Cancer Center in Brockton is just as good as they have in Boston or New York. And almost every patient, if they're diagnosed here and they need treatment here, can get treated here with the same level of care and not need to go into the big city. We have an excellent team here and we're very lucky, and we work very closely with the chemo doctors. We're all on the same floor, we're on the same building, and it makes it much easier to coordinate their care. If there's any issue, the patient can go run right across to medical oncology or come across and see us. For the doctors, it allows us to meet regularly and talk and come up with treatment plans that are specific to each patient and work very closely to take care of each patient.